Hi, good evening to everyone. Thank you for joining me. I'm Dr. Philip McMillan, and I've been looking at the pandemic through the paradigm of autoimmunity since early 2020. What it has allowed me to do is to see patterns in the disease presentation and try and then work out how this fits with regards to how people get sick. Now, this paradigm I've used for a long time, and it is largely correct most of the time. I can't say 100% of the time, but almost all the time, I'm able to predict what's going on using this paradigm. Now, I'm going to be taking you through this paradigm with regards to syphilis cases on the rise, and I'll, as usual, make reference to this elephant in the room. Now, you have to realize the elephant in the room is not always the problem, not directly. Sometimes it's an indirect association. And this is one of those times where I'll be trying to explain to you how to think about it. How is it relevant that we can talk about the elephant in the room and work out strategies to be able to mitigate it? Before I start, I'd just like to encourage anyone. If you have been following my presentations, that one is on hypertension, vaccine induced abnormal heart physiology, how to prepare for the next wave of the pandemic. These are all courses, the links below if you want to join on this research journey, because I want you to be able to understand and predict how this is going to happen and how it's going to present over the next few years. So this is what I'm focused on now. And I'm showing you now what I was able to do just this morning. Well, not even this morning, within about half an hour before this presentation, to just be able to integrate the questions and try and find some logical answers. So this was the story that caught my attention. And it was published on the 24th of February 2024. And so that you can see it, I'll make sure my pointer is on. So 2024. And this is in Canada. So it was making the point that Canada almost wiped out syphilis. Now the rates are skyrocketing as more women and infants get infected. And it was making reference to the fact that in the past few years, now just a decade ago, syphilis was almost eradicated in infants. But just within the past year, you have now had a 15-fold increase in from just 8 cases 8 years ago, 5 years ago, to now 117 cases. And so when I see that, something like that, that immediately jumps out at me and I say, well, how could this be connected? Is it just post pandemic promiscuity? Is that possible? Or is it related to the elephant in the room? And if it is, how is it connected? So I'll show you how my mind works. You don't have to agree with me, but you can understand what I'm looking at. So let's start with a few basic things. So I've gotten the data from Canada here. And so this is showing you, this is up until 2021, the number of cases of infectious syphilis by sex in Canada. And you can see that this rise was occurring since 2016, 2018. This is then 2019 going up to 2020. It levels off in 2019, 2020, and then it starts to rise again in 2021, 2022. If I'm right, and this is connected with the elephant in the room, we're going to see these cases continue to skyrocket. And you have to understand the mechanism. As you can see here, between females and males, there's a significant rise across both. This is among the gay community, it has been stable. So, this is relevant information, and this is the bit that we need to try and understand. So, if this is related, and so this was the question I had this morning. So, I thought to myself, well, if this is just related to promiscuity, more and more people are having unprotected sex, then we should see a rise in all sexually transmitted diseases. So that was the first question that I had. So straight away, I went to because we're talking about Canada here. So I went and looked and saw what it was. So this is about chlamydia, gonorrhea, and infectious syphilis in Canada 2021 surveillance. So this is talking about 2021 as well. And so as you go down, this is referring to chlamydia here. And then I'll look at the image here. And what I can see here is when we look at the years from 2012 all the way to 2018, 2019, that's where the highest level was. So there was a rise, but in the pandemic period, there is a drop off in 2021 and 2022. That is a flag that, okay, this is not just simply promiscuity. So, what about something else? The other big one is gonorrhea. And you can see here, this here is with regards to gonorrhea cases by age and group. And you can see here that in this slide, again, the same pattern up to 2020, 2019, it peaked, fell off again in 2020, 2021. This was not the pattern that we noticed with regards to syphilis. With syphilis, there was some settling off, and I go back to it, but it continues to rise in 2021 and 2022. So this is not just about simply sexually transmitted diseases. There must be something else that is going on. Is this something unique to Canada? And again, you stretch your mind and then you apply the question, well, what's happening in the United States? This is the CDC's document looking at 2022. And you can see here that they're highlighting that chlamydia cases were rising. Again, 2019 falls off, 2021, 2022. Same with gonorrhea cases rising and then falls off. On the other hand, syphilis continues to rise, as well as congenital syphilis. So this is relevant because it is not in keeping with the other sexually transmitted diseases. This is where you come back to elephant related disease, because what was different in 2021 and 2022? Now, some people may think that is searching for problems, possibly, but it's because we have to look for problems. That's essentially what we need to do: try and anticipate what is going on and try and make sense of it. So, in order to understand this, then I'm just going to show you a few slides, and this is where it comes back to my research. So, I'll show you some slides and show you how I'm thinking, then I'll try and explain what it is that I am seeing. The first thing you have to understand is a few characteristics about certain bacteria. In this case, I'm showing you a granuloma. And this is primarily talking about TB, tuberculosis, because it's a bacteria that is really hard for the immune system to deal with. But guess what? In terms of syphilis, the bacteria Treponema pallidum is also very hard for the immune system to deal with. So, what the immune system does when it can't get rid of it completely, it creates a granuloma. And this is what a granuloma looks like. So, you see all these immune cells around here. So, this in pink is a neutrophil. These are macrophages, they're activated. Then you have natural killer cells. Then you have lymphocytes at the edges. You have regulatory lymphocytes in green. So it's a very sophisticated system, and it just makes a wall around the bacteria so it can't get away, but it can't seem to get rid of it. So both TB and syphilis have granulomas. So that was my question. If there is a change with regards to the granuloma, could this explain what we're talking about? So let's take it a step further. Now, this is more to do with what I expect with long COVID. In long COVID, because of spike related issues, you have damage to the regulatory cells. And you can imagine in the image before, and I'll come back to it, you then have a situation where this is the normal granuloma, put it on full. So anywhere you had these green cells or these green lymphocytes, they get dysregulated, and so you have more inflammation. That's what would happen in the context of, say, long COVID. But there's a different mechanism in relation to viral or elephant related disease. This is what happens in long COVID. This was my prediction with regards to where you have these dark cells now being the regulatory cells. They're no longer as functional. And so you have increased inflammation around the granuloma. And so this is what could be driving symptoms in some people. It's the opposite way around in the context of infection. So follow this. Now, this is where I need to take you through a few steps. I've highlighted here, this is just an infected or a normal T cell, a lymphocyte. These can get infected by the virus. When they become infected by the virus, I've described them as almost becoming a bit dysfunctional. They are no longer able to operate as efficiently as they could. How is this connected with regards to the elephant in the room? Well, it's quite simple. In the context of recurring viral infections, that's what we're seeing in highly vaccinated regions. And this is why I warn people that if you think that just because the infection is mild, it's not causing problems, that's too simplistic. If you are having viral dissemination where the virus is no longer opposed because of IgG4 and it's infecting the immune system at will, you're going to have problems with the immune system. It's almost like an immune failure over time. And this is what we're seeing. So, how does that then present? So, this is what I have as my image. So, again, here, imagine this is syphilis, well stabilized in the granuloma. And it could be like this for years. So somebody had, say, for instance, a sexually transmitted disease with syphilis. The body couldn't completely get rid of it, so it was stabilized in a granuloma. Then what happens is because of recurrent infection, these lymphocytes are no longer as effective. Guess what happens? The bacteria is then able to break through and it becomes, rather than a new infection, a reactivation of an old infection. And that's what, in effect, I think is happening in terms of many of these situations. And then that would explain what we're seeing, for example, with the CDC. Because if it's a reactivation, you will then find these cases of syphilis rising while other sexually transmitted diseases are stable or falling. That makes sense to me. Now, it may not make sense to everyone else, but to me, that makes perfect sense. And this is why we're therefore seeing a rise in syphilis. So let's corroborate the question. So let's ask, and somebody may say, well, there is no evidence that this is the cause. But my question was simple. I ask a third question. If my theory is right, and this is about granuloma dysregulation, where the body is no longer able to control the infection. If that is correct, in parallel to syphilis, I should also see a rise in another disease. And there we have it. TB cases are on the rise, now above the pre COVID pandemic numbers. And so, what you're seeing here is a pattern of disease. So, when they looked at the annual report in the UK, the cases of TB were stable compared to 2021. But in 2022, it seems as though it's rising 4,380, and it's looking at about a 10.7% rise in 2023 compared to 2022. Now, again, people may say, well, there could be lots of reasons for that, and they're right. But what I'm saying is, in the context of granulomatous disease, if this is correct and that we are having dysregulation of the immune system around granulomas, as I said here, this dysfunctional granulomas, you are going to see a rise in all diseases that are connected with granulomas. TB will go up, syphilis go up, sarcoidosis will go up. And so that's how I am suggesting that we have to start thinking. If you just wait for it to hit, it's too late down the line. So, the most important thing at this point is to understand the principles around what I'm saying. So, that's why I said if you find this valuable, then please join me in this journey because I'm able to explain hypertension, I'm able to explain the abnormal heart physiology, I'm able to explain how to prepare for the next wave, I'm able to explain issues around pre pandemic weight gain and prediabetes. That's slightly different. But the point being, courses and principles are about you being educated. I hope that you found this valuable because I thought that from my point of view, this was a really valuable insight. I hope you find it valuable as well. And again, if I'm correct, and granulomas are the problem where the body, this immune system, has been dysregulated by recurring viral infection, these diseases are going to continue to rise. Guess what? It remains a risk to all of us, and so it shouldn't be ignored. Have a great evening.